generally try not to do this in committee, and that's try to counter the arguments of the people that testify outside asking questions. But you can't say we in Rhode Island already mandate 70 things. 70 things. The average in the nation is 40. And it's not a coincidence that Blue Cross just announced that they had earned a $15 million loss last year, even with a 14% increase in rates. So, and they're not a profit, but they're not a for-profit business. You can't blame profits. You can't blame profits to Blue Cross. The health insurance rates. You can't blame profits because they're not for profit. They can't earn profits. So, and to say that it's a free market, this is not a free market. The health insurance industry, the health insurance market is not a free market. It's so regulated, it's not even funny. Especially when you mandate 70 things, where on the average it's 40 across the nation. What we do here has a direct impact on those rates. It's not a correlation, it's a causation. You know, we've passed plenty of legislation on just correlating factors to things. Now we're talking about causation. I'm not denying that everything you're saying is a problem in terms of patient access and the cost. I get it. But if we keep blaming the wrong people, the regulations, in my opinion, come down to the problem. It costs so much to do these things. Why can Europe, why does Canada and Germany get these medications lower? You're right. They go ahead and they negotiate the price. The problem is we turn around and subsidize that price in our markets, and our consumers wind up subsidizing those rates. And at some point, someone has to pay for it. I don't know what the answer is, but I do know it's not a free market, and I do know profits isn't an issue because Blue Cross, I'm pretty sure Blue Cross does not want to lose $150 million a year and have to lay off 30 people this year. If they had the power to negotiate with the drug companies you're talking about, I'm pretty sure, I don't want to put words in their mouth. I'm pretty sure they would have done that right now because I don't want to lose, no one in business, regardless profit or not profit, you don't want to lose $150 million. You don't want to have to lay off 30 employees, especially not for profits. They don't want to do this. You know, if they had the leverage, God help them if they haven't used it yet. And again, we keep making these mandates. We keep passing these mandates. And at some point, Blue Cross is going to go out of business if we keep doing this. And then where the hell are we? And that's the biggest problem. And again, I understand the problems are there, but these mandates forcing it, it's not a free market anymore. It's because of the regulations that have put us in this position. We've over-regulated this market.